Hello, thanks for joining me in this webinar. There are many helpful webinars out there for psychologists, such as those offered by the Australian Psychological Society and psychologists like Barb Kelly, covering the technical requirements, considerations about which platform to use, and what is possible with this technology. What I hope to contribute to this ongoing conversation is emphasizing the value of your existing skills and strengths as a practitioner in moving into this medium, and greater references to the research with using this medium in working with children. As is appropriate in our Australian context, I want to acknowledge the Wurundjeri Wurrung people of the Greater Kulin Nation and the other traditional owners of country throughout Australia, and recognise their continuing connection to land, waters, and culture. I pay my respects to their elders past, present, and emerging. If you haven't already, please ensure you have your preferred beverage and a snack with you for self-care as you proceed through this. The various terms used in research studies have been video psychotherapy, mental health care, video conferencing, telepsychology, clinical video conferencing, Skype counselling, e-counselling, and a few others. For consistency, I will just use video counselling in reference to the research that's out there. There was one slide on online assessments, which of course is a much bigger issue on its own. Your strengths and skills as a practitioner will still shine. It is understandable if practitioners are concerned about moving to a new medium for their work, particularly when that medium is not one they've been trained to work in or trained in professionally. However, there's substantial research that practitioners with little training whatsoever continue to achieve similar client outcomes. Hilty et al. 2016 examined studies from 2003 to March 2015 into the use of video counselling of children and adolescents and found little to no difference between video delivered and in-person care in quantitative or qualitative measures. The medium was also seen to have advantages over work in a typical clinic, such as increasing the comfort of the child as they can remain in a familiar and safe settings, e.g. their home or classroom, being able to obtain a more comprehensive and contextual perspective of youth symptoms, behaviors and triggers, particularly in their own natural environment. And certainly it's been able to engage the child and the caregivers in ecologically valid interactions, as well as, of course, avoiding the stigma of having to visit a designated mental health clinic. Kozics and Yellis in 2018 found the medium better for children and teens, for patients with high levels of anxiety or hypervigilance, and on the autism spectrum, as it gave clients a greater sense of physical and psychological control of the session. These results with children and adolescents reflect systematic reviews of work with adults, where the medium did not have an impact on outcomes, with non-significant differences between the rates of symptom reductions for either face-to-face or video conferencing psychotherapy, as reported in Norwood et al. 2018. Research by Richardson and Dewich, 2015 report that telepsychology feels different to a typical face-to-face therapy session, but does not necessarily feel better or worse. It is often the practitioner and not the client that rated the therapeutic alliance lower with video in many of the studies over and over again. With the rapid transition to service delivery over this medium, practitioners now have to face under these COVID-19 conditions. It's helpful to know that our whole psychology profession, like most other professions, are all doing this transition at the same time. So nurture and draw on the experiences of each other at this time. As with all new skills, practice increases performance. Richardson et al. 2015 details the experiences of 8 participants aged between 27 and 52 years receiving video counseling over 11 months in rural Western Australia, and found the overall satisfaction improved with all aspects of the video counselling experience with time, for both practitioners and the clients. Even with the easing of restrictions, it is likely that there will continue to be future client demand for video counselling services due to its improved access, as reported by Bradford, Caffey, and Smith in 2016. Additionally, institutions and organisations see it as advantageous and inexpensive to service the broader population from smaller numbers of centres, like sort of a number of reports out there, such as Lange, Zadar et al. 2017. Of course, it is important and useful always to reflect on your current practice, for you to know what you see as your strengths as a counsellor. How do you establish rapport with your clients? What's important for rapport building from your experience, from how you approach it? What areas of interest do you often explore? What handouts, what tools do you prefer to use? For example, emotional thermometers, whiteboard, puppets, or other, equipment. And because you can work how you work can still largely occur through the video medium. Now, it is helpful also if you can think of something you currently do that you think you won't be able to offer online. And when you do that, to reflect on why you operate as you do, what it is that's important about that, what are the reasons behind it in terms, that's more important than what you do, because you might find that if you can't do a particular activity or use a particular tool, but if you think and reflect more about why you want to do that, there's often an alternative way of approaching it. Now, in regards to suitability of clients, in general, if the client is quite young or undeveloped in intellectual capabilities, of course, you might focus on delivering training to parents rather than the child itself. Now, traditionally, these 5 areas, are considerations relevant in determining the suitability of using any approach with clients. Certainly client access to the technology, including the IT capabilities of them. I mean, certainly if the client doesn't have access to the technology or the ability to operate it, there will be, problems. Schools will often be able to assist with this issue. When we looked at symptomology and severe psychological disturbances, Hilty et al. 2016 concluded from their systematic reviews that any child or adolescent is appropriate for video counselling, finding similar outcome results compared with face-to-face therapy for depression and behavioral issues. And in fact, it was significantly greater improvement for inattention, hyperactivity, combined ADHD, ODD, and role performance using video counselling over face-to-face, as I said. Flemington, 2019, found similar treatment satisfactions and engagement with children of conduct disorder, though noted the modifications necessary for children with callous, unemotional type conduct problems. There are some inconsistent results related to disordered personalities, Kozics and Yellowlees, 2018, Richardson et al., 2015. But to a large extent, they, it seems consistent. It seems like to a large extent there was a good basis to apply it for most children and adolescents of all conditions. Certainly in terms when it comes to crisis and risk to harm and self, I mean, there often is quite a lot of concern about that, but we know that Lifeline, which only offers telephone and internet chat, as well as kids helpline, demonstrates that even in high risk circumstances, counseling, distance counseling can be very effective. Now, if treatment involves interactions with both parents and children, it has been noted that aggression can often arise in any settings of parent-children interaction therapy or PCIT. And so where there may be possibility of domestic violence within the family, or poor parental impulse control, PCIT at home should not be considered. Certainly when we I'll have another slide about disability, but for most students with disability, with appropriate access to technology, video conferencing actually affords greater accessibility than face-to-face. Certainly, there might be some activities and assessments that cannot be performed, but again, it's about reflecting on the purpose of these and what equivalent alternatives are possible. Now, video counselling is a different medium with different characteristics. Grondin et al. 2019 identified the filtering effect of video conferencing can lead to the loss of nonverbal cues, reducing the degree to which empathy can be felt, conveyed, and perceived. However, other characteristics of this medium not only compensate, but often make this medium more preferable for children and adolescents, which we will explore later. And that's a reference to some of the stuff that Kozics and Yellowlees does again. Now, one factor to note is what's termed the online disinhibition effect, first termed by Suler in 2014, which is often mentioned in research as a negative in areas like cyberbullying or an extra distraction when doing online psychological testing, where individuals censor themselves less, being more open about their inner thoughts and feelings, which obviously has advantages or could have advantages in the counseling context. Now, Suler identified 6 disinhibition factors, while highlighting that his term of disinhibition is not meant to always suggest a greater insight into the true inner self, but how one's approach to self changes with the context one is in. And that is very much the case with online and offline selves. Now, as Suler's work was initially regarding the mediums of websites, message boards, chat rooms, emails, and text messages and video games, I've identified here the relevant factors for telephone icons as well as for video. Certainly the most relevant factors are the minimization of status and authority. In many environments on the internet, everyone has an equal opportunity to voice him or herself. Everyone, regardless of status, wealth, race, or gender, starts off on a level playing field. But online, it can feel much more like a peer relationship, and so people tend to be more willing to speak out, in that way. Now, certainly the dissociative anonymity and imagination still plays kind of a part, particularly if we're talking about telephone as well. But certainly there has been at least one article, written in 2020 that suggests that social media has had an impact on the traditional anonymity of the counsellor themselves, changing the previous approach of the counsellor being more of a blank slate. And so certainly, like, dissociative imagination can either play a part in, letting the client, view the counsellor, fill in the gaps of what they don't know about a counsellor, making references to their perceptions of that. But I mean, of course, that always is in play in any counselling interface anyway. Now, risk management is often associated with this medium. Williams, Turek, and Asino, 2015, sort of like highlights that for practitioners, this is a big concern. Obviously, in terms of privacy of the client setting and the condition service, it's important to clarify who you're dealing with, whether you're dealing with the child, adolescent, who the client is as such, what the limits of confidentiality are for what the client, what the child or adolescent shares, and certainly all notes and recordings are part of the clinical record and file, and will be dealt with as all existing records and files are. Certainly ensuring the privacy of the client setting is detailed in a useful checklist on the later slide. Now, I mean, obviously these other factors are often talked about in the other webinars, so it's important to understand what they are. And certainly it's good practice to continue respecting the copyright of any materials used in counselling as we work as professionals in the space. Now, certainly providing clear, explicit information for parents of adolescents and particularly of children is important. As often, particularly when we're dealing with children, the parents are going to be the main operators of the technology and managing the other resources involved with counselling. Practitioners might want to protect and should provide a kit including a guide for using your video platform and troubleshooting, which is often available from your vendor's website. The informed consent, contingency suggestions, and how to improve their internet connection if need be, and talk about safety plans. To guide. Provide them with a guide of assisting them with aspects of therapy if you're going to use them as a co-therapist, and how to protect that therapy space, to ensure privacy from siblings, classmates, or other onlookers, reduce interruptions, minimize distractions, that sort of stuff like that. Suggested room setups and all those kind of things like that. Certainly, Hilty et al. 2016 again suggested that forward planning can save time during the session by collating history in advance via web or phone-based questionnaires, and certainly there will be some activities may require the parent to be engaged in providing the direction to the child. And certainly those students of hyperactivity and impulsivity may require more preparation and supervision at the client side. It is important to provide understandable explanations to children about what to expect when they see a counsellor. This is an example of a book that I've written that's freely downloadable, to pass on to parents. Working with adolescents, providing clear, explicit information is valuable, especially if you're delivering it to them directly without parental presence. Similar sort of like factors that come into play here, but perhaps more so with adolescents, it might be appropriate to talk about some of the conditions of the session, such as issues with recording, particularly them not recording, any of the session, and expectations of focus and attention about, what your expectations are about other devices or other online or offline activities they might be doing at the same time. Reasons why you might choose to discontinue the session, as well as, what is appropriate setting for the sessions and conduct, dress, postures, behaviors as such. And particularly with adolescents, you might find that at times they will prefer to use the text chat feature of your conference software, for greater privacy at times. Now, this covers some of the checklists that's provided by the Australian Psychological Society, just to make sure you have at the start. Certainly, if for existing clients, it might be very useful to acknowledge the change of venue as well. Now, when we look at the practical considerations for setting up the session, here are some details. It is important to recognize, the background of your own personal thing as well, that you're not inadvertently revealing personal information that you don't want out there. And then, how you personally manage your own space in the midst of things. I have, at this time, I'm working from home. I have 3 young children, 5 years and younger, and so yeah, it's important to work out how to manage that. Hence the headset that I'm working with. So the other points I think are reasonably self-explanatory there. So certainly, as practitioners, has favoured a upper body framing of their video image. Over 60% of usual gestures and arm movements are usually out of frame and therefore unseen by the client. So it's helpful to ensure your hands are visible but close to your body, so you're not doing this, or have magic hands that appear out of nowhere. And certainly to exaggerate body gestures to compensate. That's some that we can see the work there by Gronden involved with that. Other practical considerations in the setup. Again, please make sure you test prior to the session, or factor, the first part of the session, at least 10 minutes to with technical setups obviously it's important to periodically check if they hear okay as well. Again, some of these other factors are important. And yeah, to begin with, it is important for you to plan or arrange shorter sessions, just so, because it is likely to take more energy if you're not used to this. There are also additional stimulation that comes with video conferencing, and we can look up things like the Zoom fatigue effect that's out there as well. Now, certainly when we're looking at the therapeutic alliance, an Australian systematic review of 23 years of therapeutic alliance in psychotherapy via video conferencing, Simpson and Reed, 2014, overwhelmingly found clients rated bond and presence at least equally as strongly in person settings across a range of diagnostic groups. It was noted that both the client and therapist described being completely absorbed by the therapeutic process without feeling distracted by the technology, with clients being more active with higher levels of initiative, spontaneity, trust, and disinhibition in the positive sense. Kozik and Yellow-Lees in 2018 found clients, including children and adolescents, rated video conferencing psychotherapy as more egalitarian and collaborative than in-person therapy. It certainly seemed to reduce, they reported reducing or reduced patient anxiety as they're seen from their homes and other familiar settings. The clients felt a greater sense of control over the interactions, and the filtering effect of video conferencing, which often is seen as providing a greater physical and psychological distance, actually in fact provided more safety and allowed them to have an increased sharing of intimacy as a result. Certainly therapy over telephone as well. Lingley, Potty, and McGarth, 2006, had reported equivalent therapeutic alliance to face-to-face over telephone. Certainly it is important, I've highlighted here the working alliance inventory, particularly short scale, identifies the three key elements of therapeutic alliance: the task, the bond, the goal. Certainly there's also the SRS as well. The children's SRS or session rating scale, listen to, importance to me, experience, and overall. And it is good to keeping that in mind. Certainly considering how you establish rapport currently is important. Now, as play is standard practice for engaging children and adolescents, remember it is possible via video to do a lot of that play too still. Drawing, sharing pictures, virtual high fives, or more appropriately, virtual elbow bumps these days. Telling stories with action figures or puppets and playing games. Those kind of things are still very possible. It is important, again, to think about what are the general beneficial therapeutic practices involved in establishing rapport, in working, having a positive therapeutic alliance. So it is important to, keep these things in mind, again, that is from, as usual. This stuff is from Carver et al. 2018, looking at a meta-analysis of the prospective relations between alliance and outcomes in child and adolescent psychotherapy. Certainly, here is an example of the children's SRS scale, something that's very easy to incorporate into your practice. As all practitioners know, therapy, especially with children and adolescents, will occasionally never go to plan. Relax if things go wrong. Backus et al. 2012 systematic review found most dissatisfaction with video conferencing primarily involved the technical challenges. But those issues had little impact on overall client satisfaction ratings. Video counselling does not need to be treated apologetically, defensively, or the poor cousin to face-to-face therapy, Richardson et al. 2015 reported. As practitioners who persevered with the technology long enough to feel confident using it and capitalize on its strengths, were satisfied with it and its ability to produce equivalent client outcomes. And of course, it's okay to admit that you're not a tech expert, and that you don't know, you know, some of the other things related to video counseling. Often clients describe feeling that their relationship with their therapist was more open and connected on a deeper level if a therapist used self-disclosure techniques, particularly for adolescents, or those from racial or ethnic minority backgrounds. And so it isn't, it's useful to remember that it is fine that if you don't know anything, like you don't know anything about other areas beyond your scope of practice or expertise. And even in spite of all this, some clients have described benefiting from therapy despite the lack of a strong therapeutic relationship anyway, according to a resource of research of Noyce and Simpson in 2018. Now, certainly with the transition to this medium, it's helpful for practitioners to engage in self-calming and soothing before the session, especially if you still feel discomfort with the medium or the technology or processes involved. And slow your pace down. Pause often. Some of these other points have been covered by many other, of the other webinars in this area, and it is, again, although it's an advantage to improve our familiarity with the practical aspects of the medium, it's also helpful to improve our beliefs regarding what can be achieved as well. Again, that came up in the research at Simpsons and Reed 2014, because it is important to reduce the impact of practitioner unsupported biases about the poor possible, the lesser quality of the interactions from this medium, because that is more likely to hamper the process. It is helpful for you to engage in regular continuous post-session evaluations, for example, the children's session rating scales, to help you be also assured that your work is valued by your clients too. Certainly in terms of considerations with disability, there were some points there that are worth taking note of. That very much so for disability, video conferencing provides so many advantages as well as so many additional capabilities, such as for the visual impaired, there can be continually live captioning. For the hearing impaired, there's the live captioning subtitle feature there as well. Certainly for the visual impaired, we want to focus on our auditory counselling skills that, reflecting, summarising and paraphrasing, that important to use. Significantly, we keep on finding over and over again the systematic studies, of how important video conferencing, or how valuable video conferencing telehealth has improved the mental health, quality of life and access to care, reduce costs and enhance patient satisfactions with individuals of disability. Now, certainly as young people are not always comfortable with a predominantly verbal approach, it is helpful often to engage in an activity during the appointment, such as using a more visual approach, sharing favorite art pieces, journal writing, music or personal observations, as found by Goldstein and Glueck, 2016. And then certainly other ways of being more visual are some of these points about having props, sharing your screen in order to use the whiteboard or drawing program to draw together, to play games together, to complete social scripts and other things like that. And again, Barb Kelly has some amazing, ideas in her videos about how to engage with children in this over this medium. Certainly interactive games are possible. There are lots of online games that allow, sort of like you to play with the client. It is important to check what technology they're using. If they're using tablets, certainly you might want to play to make sure that the games or the activities, the online activities work with a tablet because Flash is not compatible on some of the tablets. Certainly in terms of it's important, when working with young kids, particularly for breaks for movement, to refocus and that kind of stuff. And so students will be very familiar with Go Noodle at their school. You can do scavenger hunts, or you can encourage the parent or the teacher to prepare a kit of sensory material that might be for their self-care and self-soothing in the midst of the session. Certainly there are ways that we can provide some online assessment tools, some listings there. Berrelli et al. In 2017, systematic review and meta-analysis of neuropsychological test administration by video conferencing found that the administration of verbally mediated and visually dependent tasks by qualified professionals result in non-significant differences in norms. However, there was some variability found in relation to motor-dependent tasks that warranted further investigation. So these are some of the validated online assessment tools, as well as just a emotional thermometer that I create for my own use. It doesn't keep any of the data that's there, so you're free to use that if you want. Certainly there are some useful paid online digital tools available, and there are also different forms of mindfulness active activities that are accessible certainly over YouTube, as well as obviously things that you can deliver to yourself. Handouts, again, think about what handouts that you normally use and access, provide access to them either through emails or where they are available online to let them access them themselves with links. Certainly additional, it is important to recognize that there are some online therapy options, and that's the list of them there. And there are additional treatment options available via video conferencing, that has been shown to be particularly effective. Now, in addition to working directly with young people, video counselling has been effective in delivering training programs to parents, such as parents with children with autism, conduct problems, and early onset OCD. There's references I've listed at the end here. Although mobile phone apps are widely recommended, Hollis et al. 2017 systematic and meta review of 147 unique digital health interventions for children and young people with mental health problems conclude that the benefits have yet to be fully realized, and effectiveness of these approaches remain uncertain. So with some evidence of the short-term efficacy for adolescents and young adult depression and anxiety, but not for other psychopathologies, or in younger children at all, there's been effectiveness found. Certainly, of course, mindfulness interventions may have some benefits in general for mental health, regardless of diagnosis, yet no studies have evaluated the effectiveness for children and young people with mental health issues, using these kind of like mobile technologies yet. So again, remember, growth is never linear, but practice increases performance. Be kind to yourself. Take more breaks initially. Engage in lots of self-care. Again, nurture and draw on your colleagues in this new journey of discovery of a broader professional skill set, and be assured that your strengths and skills will continue to be fruitful in using this medium. I'll also include a link to the PDF for this presentation, and here are the references that I consulted, and for those who have access to the Australian Psychological Society, the AP has provided some very good specific resources in this area. Thank you for joining me, and I wish you journey best of in your journey forward in this area, and thank you for your valuable work in making such a positive difference in the lives of children, adolescents, and their broader communities that they're part of.